the 7th SATB conference is currently underway in Durban. Let's get the very latest now. We're joined by our reporter, Jayed Paulse. Jayed, thank you so much for your time. Now, UNAIDS has revealed that over 4,100 people die from TB, around the world every day. And yesterday, of course, we heard how 2 people die from TB every 9 minutes in this country. So what are some of the delegates saying in terms of solutions? What are they saying needs to be done, especially in South Africa, if you look at those numbers?
Well, a very good afternoon to you, Unati, and to the viewers back at home. And yes, we have been bringing you blow-by-blow information and coverage on the 7th SATB conference from the Durban ICC. It does wrap up tomorrow, but on the ground, speaking to delegates, just to answer your question, it's a multi-dimensional approach that they're basically saying needs to be done. I mean, we're talking about diagnostic tools, but we're also talking about following checkups when it comes to TB patients. I think that's the main issue that many health experts are faced with now, is that patients come in, they do get screened, but once they leave that facility, checking up on them becomes a problem because most of the patients don't return for follow-up checkups. So that has been the bone of contention for many of the health experts sitting in the plenary sessions, listening to what they had to unpack in their several discussions, debating, also giving some, ideas, throwing forward ideas that could possibly work. I mean, yesterday we took you through a tour of the radiology services, the mobile clinics that will be dispatched in various rural areas across the country in South Africa, lending a hand to those far-flung areas and providing people, TB patients, with a much-needed help. But, we're talking about clinical things here, Unati, but we're also talking about human lives and people. And the one question I wanted to ask delegates is, what about support? What support do TB patients get once they get their treatment? Who gives them the support? Is it the experts? Is it the doctors that are giving and dispensing this medication? Is it their family? And how do they take their treatment, and what kind of support do they need in able to carry out that treatment? Because when you talk about TB treatment, we're not just talking about tablets that you take today, tomorrow, and then you're well. No, it's 4 to 6 months, maybe 9 months, maybe 2 years. But I am joined by Dr. Zolelwa Sifumba. She's going to be taking us and talking to us about the support and what is needed. Thank you so much, Doctor. Just listening to your discussion, your plenary session, it was so fascinating to hear someone talk about support on the ground, not talking heads, but actually speaking to people on the ground, the people who are taking medication. Talk to us about your involvement with ARI, first and foremost, but also how you feel that support needs to be given to TB patients in order to see a turnaround of the TB infections and also the stigma, the breaking of the stigma of TB across the country and globally.
Thank you so much for the question, and thank you for having me here today. So I am a clinical research fellow at ARI. I have been for a couple of months, and it's been great to just get involved in TB research as somebody who has experienced multi-drug resistant TB. As I said to you earlier, I was diagnosed with MDR TB as a medical student, and I still say to many people that it was the hardest thing I've ever had to do in my life, and I wasn't sure I was going to survive, and it's the isolation and the stigma that I faced, as well as just feeling so alone taking medication that made me sick on a daily basis. And I really wouldn't be here today if it wasn't for the support systems that were around me. Granted, they weren't around me in the beginning, and without them, I definitely wouldn't have survived up until this day. But support is something that is needed. It's not enough to give people pills and just expect them to take it. I was sick from the medication. I was struggling, with depression and suicidality at the time. And pills weren't going to fix that problem. I needed people around me who understood, what was going on and who could actually help me feel like I could actually finish the treatment, because I was on treatment for 18 months, and that very long time. So what I've been saying as my message for the last couple of years is that it's not enough to give people pills and expect people to take them. You have to deal with the psychosocial issues that come with the person and come with the actual diagnosis of tuberculosis. It's not enough. As I said, I as much as I was a medical student and I understood, but that wasn't enough. That was not enough to actually get me waking up every single day to go and take those pills. In my mind, I quit many times, but I reminded myself that I had to complete this treatment, but it wasn't easy. So I think it's very important to tell everyone watching today that if you know someone that has TB, anyone at all, I would say support them. Find out how they're doing, find out if they're able to take their pills, find out if they're struggling with having food with their pills, find out if they're depressed. Because we're going to end up not treating people, we're going to end up not curing people, and we may end up with people that are so depressed that they're committing suicide. And unfortunately, people with drug-resistant TB, that is quite high, people being suicidal. So your support can help them through that period and even after that period, and it's very necessary, because as I said, without the support that I got, I wouldn't be here today. I would have been killed by either the TB itself or the drugs, or I would have killed myself because of the depression to do with the TB. So I'm really happy that you asked me this question about support, because not many people talk about it. We just expect people to take treatment, but as someone who's gone through treatment, I take on a more supportive role, not just expecting them to do it and shouting at them when they don't do it. It's about understanding what are the challenges involved in taking the treatment. So, yeah.
And Dr. Sifumba, it's such a personal experience for you because you had undergone that process and now you are treating TB patients. And Unati, the presenter, just asked me, what interventions are being done to fight the prevalence of tuberculosis, not only in South Africa, not only in KwaZulu-Natal, because we have the highest number of infections, but across the globe. And we've been listening to plenary discussions and sessions by experts who say that perhaps the screening time needs to be quicker. We need to catch it quicker. Then we can treat patients quicker. As a medical doctor, what interventions do you feel also need to be added onto that, just to be able to get on top of it, try and stop it, very much like how we got on top of the COVID-19 pandemic?
It's an interesting question. Thank you very much for it. I think there's a lot that's being done globally as well as here in South Africa. And I think one example I'd talk about is the introduction of social grants for people that are on TB treatment. When I was taking treatment, that wasn't really in existence. So I think it's quite great that they're doing that. But I'm gonna say that I still feel that there's not enough psychological support. I see how the social support, it is helpful, but we need to be talking to people who are on treatment and actively finding out how they're doing. My answer is support, because we're expecting people to, and it's great to diagnose and put someone on treatment, but there is no point if they're not going to be able to complete that course of treatment. We're not going to end up curing people of TB. If anything, will cause further resistance with people stopping and starting on treatment because it's so difficult. But if you have a support system that is a part of the healthcare system itself, then at least they're able to catch out when you become depressed. At least they're able to catch out, okay, this person's they're refusing to take their treatment because, let's say, they're supporting people at home, and while on treatment, they can't go to work. And so obviously the thing that they're going to do is not take the treatment because they need to continue working for their family, But And without the support, we're going to lose people. And for me, I think it's part of the reason why we're still losing millions of people daily to TB, an age-old disease. But for me, personally, having gone through it, knowing it as a patient and knowing it as a doctor that's treated people on treatment, it is very hard. it's not easy, it is, and there are still people today that we're losing because it's not easy, So I would honestly like to challenge, all the powers that be in the world, that they start actually supporting people. Support groups are needed, telephonic support, any kind of support, but people need people in their corner. Fortunately, I had a group of TB survivors that understood what it was like, to be sick in the middle of the night, and now you need to go to work or school the next morning, and it's just, it's crazy, and you're the one who is sick. And it's not just the sickness, the TB, it's the sickness from the medication too, and it's difficult to actually convince someone that actually go on, support. I know some places are doing it, but I still personally don't feel it's enough.
Dr. Sifuma, thank you so much for lending your insight and also talking to us. Honati, support is the one aspect that has been addressed in one of the plenary sessions. As you heard there, Dr. Zolelwa Sifuma talking about her experience as not only a TB survivor but also a medical doctor, calling on all the powers at be, as she said, government, anyone, civic organizations, technological organizations, to come up with ways and means to try and get support systems going, maybe, digital also, so that we can spread the word into places, to spread the word to people on the ground that they're not alone when they're taking the drugs for TB, that they're not alone and they can fight it, they can overcome it, and they will come out on the other end. Well, that's where I leave it, Unati. I hand over to Minoshni Pillay, who will be closing the conference tomorrow. It's back to you in studio.
Well, thank you so much, Jayed. And just before I let you go, it's very important what Dr. Sifuma was saying. I do hope that she was one of the panelists, because what she's essentially saying is that no matter the diagnosis, no matter the treatment, if you don't have that psychological support, you are going to have a lot of people still being very much resistant. So I do certainly hope that that focus of psychological support and all forms of other support were in that conference, were made priority. Thank you so much, Jayed Paulse, coming to us live there from Durban. Of course, it is almost the end of that conference. It's the 7th TBSA conference.